Hi. Well, welcome everyone. Good evening. We've had a few questions sent around to us, and I'm thinking that there's going to be a lot more questions coming through. I have the list of questions here today. I'm still in the operating theater. We've just finished operating. I'm still in my sexy operating gear. Today on the list, we were doing 2 arm lifts, 1 breast reduction, 1 breast augmentation, and they're all doing very well. They're all waiting to see everyone. They're probably on now watching. I can see a few people have logged in already. Tomorrow's going to be another busy day, and we're all waiting to see what questions come through. I've had some good questions, and I've had some interesting questions from the patients today. Someone was asking me what was it like the first time I operated on someone and handled someone's body. It was a long time ago when I first operated on someone, but at the beginning it takes a bit of getting used to, especially since afterwards you're sort of wondering what effect you've had on their life, and then you meet them as a person as opposed to flesh that you've operated on. So it's quite an experience. So I can see a few people have joined on. I'm just gonna quickly run through this list of questions that have been sent to me. Let me just have a look. I've had a question from Mahyar. She's asking, how do I minimize the risk of lymphedema after thigh lift? And also, does a thigh lift have a harder recovery and a high risk of complications, and how do we avoid them? That's a good question. So the 2 main risks with doing a thigh lifts, in my opinion, the major long-term risk of doing a thigh lift is, as you said, is a lymphedema, which is a swelling that doesn't go away. So people who've had, you would know about people who've had breast cancer, have their lymph nodes taken out of their armpits, then they get this swelling in their arms, this lymphedema in their arms that doesn't subside, doesn't go away. There's a particular method of thigh lift that I haven't actually come across anybody else doing it, but it's used for arms regularly, and I've been using it for thighs. And that's what I use to try to prevent lymphedema. It's basically the way I resect the skin, I leave all the lymph vessels behind. And touch wood, so far I haven't had any lymphedemas in any of my thigh lift cases. Because of where the wound of the thigh lift is, and because the wound is sort of precarious position, it gets sweaty and bruising and all the time. Getting minor wound infections is very common. So I'd say in my hands, 4 out of 5 people get some kind of wound infection. And that's just a matter of keeping the wounds clean and looking after them as if you would look after your eyes. People have suggested different ways of making life easier after a thigh lift, because it's quite a big cut that goes all the way to your back. So sitting on a toilet, for example, is uncomfortable. Sitting in a bed, walking around, driving, it's all uncomfortable. That's what makes it difficult thing to recover from. But at the end of the day, it's not undoable. It's not a particularly painful operation. It's just because of where the wounds are, because of the location, it's difficult to keep them clean and avoid small infections. So Ellen's just asking, what do you think about using arnica? I think arnica is great. Arnica comes in the homeopathic pellets or as in creams. You can use the pellets before the surgery, and you can use the creams after the surgery, and I think it's great. And there's actually some reasonable scientific evidence that it works after surgery for reducing bruising and swelling. The other question I had, it says, do you suggest tummy tuck or breast lift and augment first? And do you do lower body lifts on the Medicare? If you're doing tummy tuck and breast surgery as separate procedures, then I suggest you do it. You do the tummy first and then the breast. That's my opinion. Because in my hands, that gives me the opportunity that if something needs doing, so small adjustments need to be made to your tummy tuck wounds after surgery, I can do that at the time that I'm doing the breast. So particularly with people with massive weight loss patients, that your skin expands in 3 dimensions, and even if you have a floor-de-riz tummy tuck, you might still end up with a bit of loose skin at the top, and doing your tummy first and then your breast later gives me the opportunity to get rid of that extra skin. So that's just in my hands. Yes, you can get lower body lift. I need to talk to people about lower body lift actually. So my understanding is when people talk about lower body lift, you're talking about what they call a belt lipectomy. So you're getting the front and the back done. I think you need to appreciate that the surgery you get on your back is directly opposite to the surgery that you get on your front. So on your back, basically cutting rid of the skin and lifting the bum up, and on the front, so you're getting rid of the skin and pulling the tummy down. So it usually starts with you lying on your tummy, you get your back lift, and then we turn you over and do the tummy tuck. In my hands at least, I feel like I can't do as tight a lift as I would like, neither for your back nor for your tummy when you do it as a belt. Because I feel like when I do the tummy tuck, I want to make it as taut as I can. So we actually bend the bed, and as you know, people who've had tummy tucks afterwards, they walk bent over because they can't stand up straight. And when you bend that up, that stretches the wound on your back. And I've had at least 2 people that the wound on the back opened up because of the tummy tuck. And now when I do a belt, I don't take as much skin from the tummy tuck as I would like to, because I know it's going to make the back wound open up. So I suggest to people who are not doing it for cosmetic reasons, people who've had weight loss and you have extra skin, I suggest to people to get it done as 2 separate procedures, because that way I can do the best back lift and then I can do the best tummy tuck. And then, in my hands at least, I think that works better. It looks better. Someone asked, how long is full recovery after lipo on the abs? Any liposuction, you have some kind of bruising for about 6 weeks. It takes about 6 months before you see the final results, because the couple of things that happen long after you do the liposuction is that a bit of fat dies and your body has to absorb that fat, so you continue to get reduction in the size, but also your skin that's overlies that liposuction has to shrink back. That takes a while to happen. So it's usually 6 months, even up to a year before you see the final results. But your recovery is about 6 weeks. Claire saying hi. Hi, Claire. There's an anonymous question. Do you do the face for people with droopy skin after losing weight? Well, yeah. I mean, it's quite often that people need a face, especially neck lifts. But you have to know no surgery on the face or neck is covered by Medicare or your health fund. This is all private, so you have to pay for the hospital, any aesthetist, surgeon, any assistant, everything's out of your pocket. It's not covered anywhere by Medicare. So faces and anything to do with labiaplasties are not covered by your health fund. It says people who are prone to keloid scarring but want surgery. I suggest you get it done by a surgeon who knows how to deal with your scars. So there are ways within your surgery that you can prevent keloid scarring. So sort of surgical techniques, but there's a lot that you can do afterwards. So as soon as, well, even before your wound is healed, there's surgical treatments. Topical treatments, laser treatments, and then later on, you different types of laser needling to prevent your scar from becoming a problematic one. So you need to get your surgery done with someone who has access to all that stuff. The question is, do you do lipo when you do thigh lift? I almost 100% of the time do liposuction when I do thigh lifts. That's part of my techniques. So yes. Yeah, I had this question before. Someone's asking if they have their period when they get surgery done. Honestly, it doesn't make any difference to anybody. Nobody minds what's going on. Let me have a look at another question. It says, if you're having several procedures, which one should you do first? Well, that's a very common question. People always ask that. If you're having several things done, if you don't have a preference, I suggest you do either your tummy or your arms. Mainly because it gives you the biggest bang for your buck, and you get the most dramatic result, and you're motivated to do more. If you do something that's hard to recover from, then you might give up and not do anything else, then you'd be disappointed. Most people do the tummy first, and I think that's a reasonable idea. In all honesty, probably recovery from arm surgery is more difficult than recovery from a tummy tuck, because it restricts your mobility and your movement. So you're probably better off doing that. But if there is something that bothers you particularly, I suggest you do that first, unless it's your thighs, because a lot of surgeries affects your thighs. So your tummy tuck, for example, should lift your mons area. It should lift the front of your thighs. If you go and give them lower back lift, it should lift the outside and the back of your thighs. So if you want to get your thighs lifted, then I suggest you do that after you've had your tummy and your back done, and that minimizes the amount of scarring you're going to have on your thighs. That'd be my suggestion. I can see Amanda's here. Hello. What else is there? So the next question is here. What do you recommend as a course of action for wound breakdown? And when should we be concerned? So it depends. If you're nearby, like if you've traveled interstate for your surgery, then you should have a local doctor that looks after your wounds. If your surgeon is local, then basically you should see them when you're concerned. My usual protocol of action is that if you have a wound that's broken down, you should have a wound swab to see if it grows any bugs. You might need to be on antibiotics. And I initially tell people to start a dressing that kills the bacteria, so betadine or silver dressing. You try that for a few days. Once the wound is clean, then you need a debridement, which is usually surgical. So your surgeon or a competent doctor needs to clean it up. Or you can have a chemical debridement, so the types of dressings that can clean off the little yellow slough at the base of the wound. And then from then on, you have moist dressings until your skin starts to grow back. And then once your skin's grown back, then you have dry dressings until your skin's strong enough to look after itself. That's my usual protocol, but I suggest you ask your own surgeon as to what they prefer as well. Heather wants to do, if we do a breast reduction, I've had would a muffin top look more prominent after a breast reduction? Well, short answer is yes. It depends on where your prominent breast is. So if you have a very hourglass figure and you have a breast reduction and you lose the top extension of your body and your so-called muffin top becomes more prominent. But if your breast is only at the front, then no, then it's not going to make much of a difference in your appearance. And answering Danielle, yes, the incision for the lower body lift connects up with the tummy tuck incision, so it's essentially a belt that's done into two procedures. So yes, it all connects up. He's saying hello. And Melissa's waiting for her surgeries next year. Let me read the next question. It says, how much of our ideal weight must we be for surgery to occur? I've been stable for 6 months. Well, see, the ideal weight that your weight loss surgeon gives you is sort of based on your BMI, based on a lot of factors, but it's an educated estimate of where you should be. So I wouldn't be too worried that about the weight, as long as your weight is stable and you feel like you're not going to lose any more. I think you can have your surgery. I don't think another extra 5 kilos is going to make any difference. Says a 62-year-old for a tummy tuck. Well, I did a 67-year-old last week. So no, I did a breast reduction on a 73-year-old the week before. So I mean, if it bothers you, you should get it done. I don't think age is a matter. I think 60 is the new 40, they say, don't they? So the next question is, do you do surgery on complicated cases, such as people with poor healing? Or do you deal with cases? Well, people who've had massive weight loss are complicated cases. They're all complicated cases, and they all have poor healing. Person who's been with a very high BMI and have lost so much weight was at a level of malnutrition to put on that much weight in the beginning, and is now at a level of malnutrition to lose that much weight. So they will have poor healing. So yes, we deal with them all the time, and especially it's the hospitals and anesthetists that need to be equipped to deal with it. So we try to put things in places that can deal with those sort of things. Ramonda wants to know they've lost 40 kilos and how long before they should start looking into surgery. I think you have to have a stable weight for 6 months before you have surgery. At least 6 months. So you will know that your weight is stable, you're not going to lose any more. Answering to Heather, it's hard to tell without looking at you whether you should, what you should do with that extra. It depends. If you have extra skin, then you need it to be cut out. It might not be a full abdominoplasty, it might just be a wedge resection on the sides. But if you have, if it's not skin excess and it's just fat, then you can just lipo it out. Ehlers-Danlos is a particular question to answering Taryn. It's funny, if you read the support documents for Ehlers-Danlos, people from their societies, for example, they suggest to them to go and get facelifts and things done by plastic surgeons. If you read the textbooks that are written for plastic surgeons, they always say don't operate on people with Ehlers-Danlos. I have operated on, I must say, probably a handful, maybe 4 Ehlers-Danlos patients in my life. I've never done anything beyond the facelift. It's always been facelifts, and they've always healed well. But I haven't offered body contouring to anyone with that. But I think that's something that needs to be dealt with on a case-by-case basis, because Ehlers-Danlos is such a huge, vast area of wound healing problems that not everyone's the same and they need to be treated differently. If someone has a peg tubing, you can still have a tummy tuck, so just your pegs just needs to be repositioned. So yes, that can be done. So Daniel wants to know, after tummy tuck, we're clear to go back to the gym. Will there be significant impact on muscle use? If muscle repairs occur, do we expect movement and function to be different? Yes, you need to retrain your core, because if you've had muscle repair, it means that the 2 rectus muscles on your abdomens have been separated and that they haven't been working in the way that it's supposed to be working. And now that they've been brought back together, they need to learn to function together again. So you need to re-establish your core, so sit-ups or that sort of thing to get it going. Sarah is asking, can I start looking at booking surgeries in? Yeah, same thing, Sarah. You just gotta be at a stable weight for 6 months, and you gotta sort out your private health insurance. Do you have any advice on who the majority of patients use for helping to pay for these surgeries? The parents, I suppose. I'm not sure. It depends. You got to be careful about how much people charge you, because I know for the same operation, and I've been told this several times by patients, that the quotes that they get varies from about $80,000 to about $5,000, and you just got to be careful who you're going to. So the more expensive doesn't necessarily mean better. Do I suggest any vitamins or supplements pre and post op? Yes, I suggest vitamin C, vitamin B6, B12 before the surgery to boost up your healing. Zinc supplements, particularly good. If you have umbilical hernia and you have a mesh, It's not an issue. You just your surgeon just has to know about it. But I do. I mean, a lot of people that I operate on have had some kind of hernia repair and have mesh in there. It's not a problem. But we just have to know that it's there, so we prepare ourselves. How many nights is expected to stay for brachioplasty, tummy tuck, low body lift thighs? Well, I'm assuming you're asking them if you do them separately. But for arms, people usually stay for 3 nights. Tummy tucks is a week. Lower back is about 4 or 5 nights, and thighs is about 5 nights. Chloe, I think Chloe asking me when wait times for surgery for me. It depends. I mean, there's always cancellations and things. There's always time, as long as you're not combining things, so you don't need 7 or 8 hours. Then we can always do it. So answering to Joanne, if you want blood suction to an area that's not part of the surgery that you're having, then yes, even if your surgeon doesn't charge you, the hospital will charge you because that's not part of your procedure. Yep. I can see Christine's online. You should be recovering. You shouldn't be on Facebook. Debbie wants to know, do you have to wait for a year after a baby? That used to be the case, but that changed in 2016. So that hasn't been the case for about 2 years. So no, you don't have to wait for 12 months. You just need to fulfill the weight loss criteria and not anything else. Answering Chloe, I prefer to do 1 surgery at a time. I don't like combining things. Especially with people with big weight loss, I feel like it's a big ask for a body to heal multiple things. So I try not to combine things. I agree with Danny. I think Christine's on some good drugs at the moment. She probably has a pain button that she's enjoying. If someone has anemia and on an iron infusion, should that be done prior to surgery? No, that should be done at least 2 weeks before surgery, because it takes a few weeks for that iron to translate into hemoglobin in your blood. So you should have it at least 2 weeks before the surgery. Is lipo our choice or yours? I don't think I need it. Just get. Well, it depends. So for certain things such as thigh lifts, arm lifts, lipo is part of my technique. So I do it for everyone. For some things such as tummy tucks, it's not part of my technique, so I just do it for people who need it, which is most people. But if you have a particular feeling about it that you don't want it, and you don't have to have it, that's perfectly fine. Sasha, thank you very much. Lovely. Now, question says, where do patients stay when they come to visit you? I mean, if you're coming for a consultation, say, if you call the rooms, they can suggest a couple of places around that you can stay at. Scar management after FDL, there's 2 types of stratoderm that I recommend. There's a blue stratoderm that I've recently tried a couple of times and I had good results with. So the blue packet of a stratoderm is good even on open wounds. And there's an orange stratoderm that you use once your wounds have healed. After about 3 weeks, or as soon as you see that the wound is raised or not flattening out, the color is not fading, I suggest to people to laser over the scar or get microneedling and flatten it out. In my experience, microneedling doesn't seem to work as well as lasering when you can try it. Is it okay to have foot surgery 5 weeks before breast lift? It depends. If it immobilizes you, then no. But if it's just a bunion surgery, yeah, that's fine. So the question about breast implants increasing the risk of other autoimmune diseases. I certainly haven't come across anything in the literature that suggests increased autoimmune diseases after breast implants. I know that there was a big question about this very thing back in the 90s, and they said the silicone breast implants increases the chance of autoimmune diseases, and that was disproven. So I haven't seen anything else that would support it. Lipo doesn't prolong the healing because it's usually done in the areas that are not part of your incision. But it is more painful, yes. It bruises, and you get big bruises, and it aches. And if you ask people who've had lipo, they tell you it's worth it. But I haven't had it, so I can't tell you. But it does make it more painful. Amanda, we can't wait to see you. How are you? And I've got one more question up here. Can I just, all right, anyways. Can I just, one of a bit of a captive audience, tell you that especially people who lost a lot of weight and are having body contouring because of that, you're not cosmetic patients. Your body doesn't heal as well as someone who's 45 kilos and 21 years old and expect a rough journey. If you expect a difficult journey, if you prepare yourself for it, if you take your multivitamins and make sure you have your iron infusions and get things ready, your journey would be much smoother. Do you get the same results from FDL without muscle repair, or does the muscle repair make the result better? For a person who needs it, then it makes it better. If you don't need it, then it doesn't make any difference. Not everybody needs a muscle repair. Guys don't need it, for example. Or someone who hasn't had kids, they're not going to have muscle repair. Have you ever done more than one surgery at a time? Chloe, yes, I have, of course. I mean, it's usually people who have restrictions on the time off work or travel or something, that they want to combine things. Because having multiple surgeries means you're going to have multiple times off work, and it's difficult to do that. So yeah, there's plenty of people who have a whole body done in one day, 14-hour operation. They're in a hospital for 3 weeks. It takes them longer to get over it, but it's definitely done. But you have to expect a much more difficult healing process. Emily, I'm just reading through your posts. Not sure what you mean by unmedicated. There are no as far as I know, there are no hospitals that do that purely unmedicated. You have to use your private health fund to use it. Mel, you can ask for as tight a tummy tuck as you want, but there's a limit. But also you got to consider that your skin stretches back. You know, when you wake up from a tummy tuck, you doubled over, you can't stand up straight. But even after 4 days, you're up straight, so your skin stretches back. So doesn't matter how tight it is, your skin will stretch. If you've had a massive weight loss, for example, your skin will stretch faster and more because you've lost the elasticity of your skin, and you've lost all the collagen, and it won't hold for as good as other skin would. Isha, yes, that is the only kind of lower body lift that I do. I do body augmentation, and it counts as a lower body lift. So yeah, it's covered by your health fund. Melissa, yeah, I'm around. If you're an interstate patient, it's difficult, but if you're here, I'm here all the time, and my patients always have my mobile number. They can contact me afterwards. So yes, you can take your vitamins until the night before. That's not a problem. I suggest you take, I think I said that before, you take vitamin C, zinc, B12. Those are good things for your healing. Susie, yes, purse string. Purse string is the same thing as the auto augmentation. So yes, it is part of a lower body lift. I prefer to do it as a separate thing to the front and back. I prefer to do front and back separately, but yes, it is. It's part of the same thing. Going back to the things that I think you should do before and after. Before, I think you should think about your iron levels. They have to be up to scratch. So a lot of people, because they've had, for example, they have a sleeve surgery, the iron sits around 9 and 10, and their GP is happy with it because they're not anemic. But if you're going to have surgery, that's not enough. You need to build it up, and you need to have reserves for surgery. So the iron of 9 and 10 is too low. You need to add iron infusions. You need to be on supplements that builds you up. So you need to have vitamins C, B12, B6, and multivitamins for at least a few weeks before. But most important thing is you must not smoke. You cannot be smoking. You're already in such a compromised position with having these big cuts. If you add up all the cuts out of a FDL tummy tuck, for example, it adds up to more than 1 meter long. You're asking a lot for your body to heal the meter-long cut, and then you smoke on top of that, and everything just falls apart. Chloe, if you want to do 2 things with a lower body lift, if you want to combine things, then I suggest you do things that are not next to each other. I don't know if that makes sense, but for example, combining tummy tucks and thigh lifts seems to be more problematic than combining tummy tucks and arms, for example, because the areas are not close. It doesn't seem to affect people as much. If you're having a lower body lift, then you might, I don't know, think about your bra lift, for example, at the same time. Iron overload is not okay. Your iron has to be within a level. You can have problems from too much iron. This garment for breast reduction, you need something that gives you support, that clips at the front and not at the back, and doesn't have an underwire. And in fact, the bras that people get from Kmart, I haven't had a problem with. I think that they're okay. That you can get special post-operative bras from companies that sell post-op garments, but you know, because you're going to be wearing these day and night for 6 weeks, they're going to get trashed. So you get, if you want to get something cheap and cheerful that you throw away after 6 weeks before you get fitted for your final bra, I think it's perfectly fine. Chloe, different labs do different reference methods for their level of iron, so you better check with your GP and what lab they use and what level of iron they suggest. The lab that I use, for example, says it has to be between 9 and 30. So if you're in the lower end of the scale, it still comes back as normal, but it's not. It needs to be a bit higher. Asia, if you need an FDL, you need an FDL. I don't think you have to choose between having extra skin and having a hypertrophic scar. And if your problem is your skin, then I think you should have the FDL and treat the scar if it happens. We had the arnica question before. Yes, it helps with bruising. When do you do a thigh lift? Is the cut in the groin and down the leg, and is there a T-junction with your method? It depends. Not everybody needs the cut down the leg, especially if you've had previously a tummy tuck and a lower back lift. Then you're less likely to need a cut down the leg because a lot of this extra skin's been taken. If you've had very big weight loss and then you do need to cut down the leg, then the way that I do it, yes, you do have a T-junction. Samantha, you need an iron infusion about 2 weeks before your surgery, at least. Sarah, yeah, so if other surgeries affect the shape of your thighs, so a tummy tuck and a lower back lift affects the shape of your thighs. So if you're at all considering getting those things done, I suggest you get them done before you get your thighs done, because it can make your thigh surgery easier. Stacey's saying hi. Hello, Stacey. How do I get my iron low? Oh, if you've got, it depends how high your iron is. So there are things we can do with hemochromatosis, so you don't need to stress about that. That's fine. Jane, you need to have your iron levels checked now, and if it is low, you need to act on it now. Fleur, yes, if your liposuction is not in the same area as your surgery, even if the surgeon doesn't charge you, the hospital will charge you extra. The cut for a thigh lift is on the inside of your thigh, so it's either only in your groin or it's in your groin plus an up and down cut that's inside of your leg. Does a tummy tuck help with the skin on your back? Not in my hands, no. It's only on your tummy. Melissa, how many hours does each surgery take? So it depends on the surgery. So breast lifter reduction takes about 3 hours. Tummy tuck takes about 3 hours. And arm lift takes about 2 to 3 hours. Lower back is about 2 to 3 hours. A bra lift is about 2 hours. But it's about that. What's the inner outer thighs under tall isolation in rooms? What's the downtime? So for liposuction in the rooms, it has to be a minimal amount. The law in New South Wales says that you can't do more than 2.5 liters in the rooms. 2.5 liters is quite a lot. in my own hands, I don't do more than 500 mils in the rooms. If your liposuction is any more than that, then you need to have it done in the hospital. That would be my suggestion. Does the thigh lift help with the outer thigh on the lipo? No, thigh lift pulls the skin on the outer thigh in. Yep, it does help with that, Amanda. How long do interstate patients stay in Sydney for? Well, usually in hospital until you go home. So, for example, if you have a tummy tuck, normally people stay 5 or 6 days. Interstate patients might stay 7 or 10 days until the drain is out and they're walking and all the stitches are out. And after you're out of hospital, you don't usually need to stay here. To Sarah, yes, you can do them together. If you do them separately, I suggest you do your tummy before you do your breast. But yes, you can definitely do them together. Stacy, what sort of revision would you suggest? Just the further reduction. I don't know if I missed your first question, Stacy. I'm not sure what sort of revision you're talking about. Melissa, can you extend the arm lift near the side of the breast if you have that? Oh, yes. Let me talk about that little third boob that happens under the breast. So that extra bit of skin it's hard to get rid of, and I'm hoping to design a little surgery just for that. But even people who get a bra line lift, an arm lift, and a breast lift, they still lift with a little bit of skin there, and it's hard to get rid of it. But yes, if you get an arm lift, that incision extends past your armpit to get as much of that skin as I can get. But even with that, it's difficult to get rid of all of it. Trying to find Stacy's comments to see what that was about. Yeah, I can't find it. Sorry, Stacy, I can't find your. So, what sort of revision would you suggest? I can't find your first comments to see what your question was. If you can put it on again, I'll answer it. The other thing I want to talk to you about is faces, because a lot of people get to a point where they don't want to lose any more weight because they feel like the weight loss makes them look aged. And that's true. Aging is basically loss of volume. And if you lose volume because of weight loss, you're basically speeding up your aging process. And you're getting older, you're looking older because you have sunken eyes, sunken cheeks. Even your bone resolves and your face just shrinks away. I think don't forget about your face. I understand that it's not covered by the health fund or Medicare, and it makes things difficult. But a neck lift, a face lift, it makes a big difference. Or even if you just get your eyelids done and your brow, I think because your face already looks so different. And people who've lost 60, 70 kilos don't look anything like they used to. I think it makes a big difference. I've got one more question sent here. Let me just bring that up. Yeah. So, how much skin does the extended tummy tuck remove? Well, it depends how much skin you have. It can be. It can be anything, from under a kilo or to 6 to 7, 8 kilos. It depends how much skin there is. But as much skin as you have. Fleur, yes, that is the Fleur is asking, is the neck classed as the turkey part under the chin? Yes, that is unfortunately the neck is your turkey part. You have these platysmal bands usually that become prominent as you lose weight, but also you get the transverse lines are up across your neck, and your skin starts to sag across here. So yes. So that also a question. So someone's asking about Mons lift. Yes. So your Mons is lifted as part of a tummy tuck, and it's lifted quite a lot. So for people who've had a cesarean, they have a gauge. You can see where the cesarean scar is. A tummy tuck scar is usually about 5, 6, 7 centimeters lower than your cesarean scar, just so that you would lift the Mons area. So yes, your Mons is lifted. And people ask me always, do you liposuction the Mons? It's very rare that you need liposuction in the Mons. It's folded onto itself and it looks big, but essentially it needs to be on the same plane as your abdomen, and as long as it doesn't protrude forward. Once it's lifted, it doesn't protrude forward, but it is lifted as part of your tummy tuck, and it doesn't need to be. You only get Melissa. You only get a catheter if your anesthetist thinks you're very dry and he starts pumping fluid into you, or if your procedure is going to be longer than 3 or 4 hours. So if you combine procedures, then you will have a catheter, yes. But normally you don't. Flair, I think you look lovely. You don't look anything like a turkey. Melissa, I get a lot of good comments from patients' husbands about the Mons lift, so I'm sure everyone's going to be happy. Do I recommend a brow lift when you get your eyelids done? Well, it depends. Not everybody needs a brow lift, and it depends on what kind of a brow lift, because there are different types. You can lift the outside of your brow up. You can lift the middle of your brow up. You can the middle of your forehead up. It just depends on where you think the most saggy part of the skin is. But it depends, because, for example, when you have a lot of skin in your upper eyelid to the point that it's become heavy and it starts pushing your eyelid down, when you cut that eyelid, suddenly your forehead muscle relaxes and your brow drops. And then you say, I'm looking worse because I'm looking angry all the time because my brows drop, and then you need a brow lift. So it depends, case by case is different. Chloe's asking, is it lifted in the lower body lift? If by lower body lift you mean like a belt, like a circumferential lift, then yes, your Mons is lifted as part of that as well. As part of it, I mean, you're getting a tummy tuck, so yes, it is lifted. And no, you're not going to get any hair growing on your chin. Your pubic hair is cut out, so your lift comes up to the line of incision. It doesn't go beyond that. Amy, if I do liposuction as part of a procedure, no, you don't have to pay extra to it. You only have to pay extra if it's a different place. Chloe, I think we've been through the Mons question. And I've had people needing only a Mons lift, but that's because they've had a tummy tuck previously, which wasn't done properly, and it didn't address their Mons. So we've gone back and just done the Mons, but I haven't lifted the Mons on its own. No, I've done liposuction, the Mons on its own, but it hasn't been for a weight loss patient. It's for cosmetic things. Samantha, the main reason wounds open up, it can be two things. One is infection, so the bacterial contamination of the wound, or your body has reached its capacity to heal, and you need to give it time. It's usually one of those things. Those would be my things. I've talked about faces. Can I just quickly talk about labiaplasties? Well, I haven't got any questions here. There is a specific category in Medicare that allows for you to have a labiaplasty under your health funds, but that's very specific, and this applies to hardly anybody. But what usually happens if people get a tummy tuck, as part of that the mons is lifted, and suddenly they notice that they need or would like a labiaplasty. That's not covered. That's not covered by your fund or by Medicare. You need to get that done separately. But generally, I think it's a good idea. If you want to know how much hospital charges, hospitals usually charge about $2,000 an hour. So if you're getting one thing done that's not covered, they'll charge you an extra $2,000. Your anesthetist will also charge you for that hour that is worked, because it's not going to be paid by anyone to do that hour. So you're like an hour extra liposuction is about $4,000 extra out of pocket on top of whatever you're going to pay. Labiaplasty can include labia majora reduction, so reduce the outside labia as well as the inside labia. So yes, it does include a bridge. It can include a bridge resection if you need it. Not everybody needs it. But it sort of depends. A lot of people come and ask for liposuction in the area. Hardly anyone needs liposuction in the area. You need skin reduction, and for it to be properly lifted in the right way. What happens if there's a complication after you left New South Wales? Do you need to find a local surgeon? Well, short answer is yes. It depends on the complications. If it's a minor wound infection, then between me and your GP, we deal with it. If you've had like an infected seroma or something that needs to be surgically dealt with, then you need to go to your local public hospital and that they deal with it. If you come back here, we're happy to look after you if you want to come back. If you want to stay there, but if you want to stay where you are, you have to find a local hospital. Thankfully, that's not common, but that's the way it goes. I'm gonna start to wrap it up so I can go home and have some dinner. Thanks everyone for listening. It's been lovely having you around. Just quickly, Janita, how long typically is the wait after C-section for a tummy tuck? 6 months. Don't do it before 6 months. You need to heal properly. Thanks everyone for listening. It's been lovely having you around, and I can't wait to do this again. I hope you all have a good night. Good night.